Welcome back to Not Your Inspiration, the podcast where we ramble about disability. My name is Gray and I'm the host of this shit show. And today I am sad. And I want to talk about that because expressing feelings is hella important. Not to get all Freudian psychoanalysis. This is a very anti-Freud podcast. If you support Freud, click away. No, but really. Today's been a hard day for me, and I figured this is my podcast, and I can talk about whatever the hell I want, and today I want to talk about, the hard parts of being sick, basically. I don't know when you're going to be listening to this, because it's a pre-recorded episode, but I'm recording this on January 29th. Well, actually, the night of January 28th. It's 2 a.m., so it's January 29th, but you know what I mean. And today is the 1 month anniversary of a really fucked up surgery, and more practically, it's the 1 month anniversary of me being in bed. So I want to backtrack a little and update you guys on my medical history. And by the way, if you don't want to hear this, I'm really sorry. All the other episodes are going to be riveting disability content, but today I'm really feeling it and I need to talk about it. I had a lot of metal hardware in my spine, and back in November I dislodged that hardware and it was floating around and it was causing my skin to break open. It was a massive infection risk. It was causing a lot of internal problems, and so I had an emergency surgery in early November to remove that hardware. And the surgery didn't go wrong. It was a bad time. I had the surgery on the day that Tyler, the creator of Cripple Punk, passed away. My birthday was a few days after that. It was just a rough time emotionally, but the surgery went fine. However, they needed to replace all the hardware that they took out, and they needed to wait for me to be healed up before then. So December 29th, which was about a month ago, was the surgery to put back in all of the hardware that they had taken out. And that's the surgery that they really, really fucked up. We don't know exactly what they did. No one really knows exactly what the problem is in true medical professional fashion. But the working theory is that because they were working on my spine and so close and in the spinal cord, they probably did something to a nerve. And the result of that, when I woke up from the surgery, there were all kinds of problems. I couldn't eat, drink water. There were just all sorts of problems that I don't want to get into now. It ended up being a pretty long ICU stay, it was just a mess. But now, a month later, I'm still dealing with those problems. And I've been completely bedridden for the last month. And pretty much unable to sit up because of the problem. The problem is in my lower back, and it makes it extremely painful and almost impossible to sit up for any length of time. I've also been having problems with my right hand, so I've been operating pretty much one-handed and lying down for the last month. I've spent time in bed before for huge periods of time, 6 weeks, 2 months. The reason that this is different for me is because during those times, maybe I'll be able to make it to the couch. Or I can, get to the bathroom by myself. I can open up and take my own meds. This time, that's not the case. I really have not been able to sit up independently. I need someone to help me with all transfers, which means I need someone to help me get to the bathroom every time I have to pee. And because my right hand is affected, I can't open my own meds. And I take meds about 3 or 4 times a day, depending on the particular day and the dosages. It kind of changes. They play around with my meds a lot, which means I need to ask for help for someone opening all my meds, and I'm on over 20. So it's a bit of a process. It's not just, grabbing someone a Tylenol. So I really haven't been able to do anything. Even this podcast, I'm not joking when I say I record it from bed. That's not like a hyperbole. I really am laying down in bed right now, laying on my side with my laptop also laying on its side, holding a microphone. That's how I record this show. And it's fucking depressing because I got out of the hospital and I haven't left the room I'm in, my bedroom. I haven't left this room for a month. I have not seen most people for a month, and I've needed help to do everything for a month. There's been a lot of complications, besides that, I had the surgical wounds in my back reopen. And because of I have a connective tissue disorder, so my skin is very, very, I have very compromised healing. And they couldn't restitch them. So I've had open wounds in my back that need to be cleaned out and covered in antibacterial cream and dressed with sterile surgical dressings multiple times a day. And that needs to be a sterile procedure. And it's a lot of work. And I can't do it myself. 1, because it's my back. 2, because I'm operating one-handed. 3, because I can't sit up. So it's been a fucking mess. And I'm not trying to complain. I know I'm complaining. And I know most people don't want to hear this. That's the backstory. I'm getting into the good juicy part now. I don't mean to complain in the sense like, oh, poor you have it so hard. But it's times like these where I really fucking hate being sick. It's times like these where I just wish so much that I was healthy. And I've said it before and I want to reiterate it here. I mean what I say when I say that I have no problem being disabled. None at all. I truly don't mind it. What I have a problem with is being sick and unhealthy. And I struggle internally a lot with that. Inside, it feels like I'm betraying my own community to say those things. And I can rationalize it away, and I know that I'm not. I know that it's okay to feel that way. But in my head, I do. And I'm guessing that I'm not the only one who struggles with these feelings. That's what I tell myself, at least. That there are other people out there who feel the same way and just don't talk about it. Or they do talk about it, and I'm just not hearing them. But it's times like these where I really feel very depressed about being unhealthy. Again, being in a wheelchair, totally fine. I can work with disability. I can work with inaccessibility. I can do activism. I can be angry about that. I can do something about that. It's productive. But fighting my own body is a challenge that I have yet to reconcile. It's something that some days it's okay, and some days I feel very powerful, and other days I just want to curl up into a ball and get that head transplant where you get a new body, you know? It's not a real thing. If it was, I might sign up. Another thing that I kind of hate myself for feeling is I feel like such a burden. And I know that that comes from this capitalistic notion that if you're not contributing anything to society, you're not worth it. And I know that that comes from my own internalized ableism, and I'm really trying to work on it. But just because I know the causes doesn't mean those feelings are invalid. I need help with everything. And the burden, not the burden, but sort of the strain of people who that falls on is my mom, who has another young kid and works full-time. It falls on my sister, who is very young, and it falls on another housemate that I have, a person who I live with, and I'm trying to protect people's anonymity here. It falls on people who didn't sign up for it. And I know that they love me and I know they'll do it, but I can't help but feel bad about that. And it's hard for me to kind of reconcile being this force in the disability community and preaching about loving yourself and being okay with your disability, while I'm laying in bed and thinking, God, I feel like such a fucking burden and I don't know what to do. It's hard for me to let those things coexist. And I know intellectually that they can coexist. I know intellectually I mean every word that I say. And I also know that that doesn't take away from the fact that this is a really hard time for me. I know it intellectually. Emotionally, that's a different story. One of my friends has kind of been coming and going from out of town and has been very, very helpful when they're here. And I feel so fucking bad about that. That's the truth. I feel like I'm a bad friend and a bad family member. I know that's not true. I know that's internalized ableism. And I can read all of the disability theory I want on it. I can talk to so many different disabled people who have the same feelings. But at the end of the day, I kind of just have to let those feelings ride their course. there's not much I can do about it. Someone who I'm close to is having a minor routine surgery, and this person is completely able-bodied and healthy and fine, but they're nervous about this surgery because they've never had one before. And me having 2 spinal surgeries within 2 months and genuinely countless others before that is trying to walk them through it. And they asked me if I would be at the hospital with them, and I'm like, I'm sorry, I can't get out of bed. I can't leave my house. And I felt so bad about that. It's hard to maintain an identity when you're in bed. It's hard to remember who you are. I haven't been able to buzz my hair. And at first I buzzed my hair because it was falling out because of a medication. But then I loved it. And I can't do that right now. And it's really difficult. I can't wear the clothes that I want right now. I've just been wearing pajamas, and most of my pajamas are very feminine. I have not been able to shower as much as I want because of the open wounds. There were like 2 weeks where I couldn't shower at all, and even now it's about a once a week thing, which sounds really gross. It is kind of gross, but because I'm not doing anything and using face wipes, it's not as gross as it sounds. But mentally, it's awful. You don't realize how much showering makes you feel human until you can't do it anymore. Whether that's because you don't have access to a shower, or you're depressed, or you're sick, whatever it is. It's hard because it's really hard to be a person when your life revolves around taking meds and your physical therapist coming over and sleeping. And because of the meds, I've been sleeping 18, 20-hour days. In the beginning, I was barely awake at all. I feel like I am one giant health problem and one giant side effect. And to be honest, that's why I started this podcast. I started this podcast, and it's so fucking ironic because what I talk about here is you are worthy of everything, regardless of what you put out into the world, and don't fall prey to this mindset that is established by old white men who want your money. But I put out this podcast because I have such a raging legacy complex. I felt like I had to put something out in the world because I was sitting in my room and I was looking at my phone at people on Snapchat and Instagram, and I was looking out my window and hearing my neighbors outside and talking to people in my family. And I felt like everyone's lives were moving on without me. And I realized the world doesn't revolve around me. I'm not as important as I think I am. I get that. But it's hard to sit and watch people live their life while every day is so stagnant. Every day is the same thing. And I felt like I had to put something out into the world. I absolutely had to, or I was going to lose my mind and there would be no road back. And so I did this. I did it on a whim. And it's strange to me and ironic that I started it because of this fear of missing out on my own life. But I think it's an irony that most people can probably relate to. I've been thinking a lot also about gender lately, and I'm going to do a whole episode on this in the future. I actually wasn't planning on recording this episode at all. It's not in my outline. This is kind of a not panicked, but, impulsive, creative decision, you could say. So I'm going to do a whole episode on gender, but I want to touch on it a little bit here. Being disabled and being not cis is such a confusing combination. Because for me at least, I have all this dysphoria. And sometimes when I'm having feelings and thoughts like, this isn't my body and I hate this body and I feel so disconnected from this body, I kind of wonder, is this gender dysphoria, or is this just the fact that I don't identify with this body that's crumbling to pieces and in pain? And at the end of the day, I think it's a little bit of both. That's not to invalidate, the fact that I want top surgery, and that's not to invalidate any of that. But I think it's hard when you don't identify with your body, when you're so dissociated from your own body. I think it's really difficult to kind of figure out what your gender is, especially when you don't know, when you're still trying to figure it out like I am. Another thing is the very practical reality of being able to present how you want to present. For me personally, I can't bind. And a lot of other people, they can't get on HRT or have top or bottom. So like there's a lot of things, and of course you don't have to do any of those things to identify as a certain gender. But people's dysphoria, makes them want to. And there are a lot of things that I want to do and ways that I want to present that I'm not able to. And I know I'm not the only one in that, but it makes it all the more confusing. And at the end of the day, a lot of it leads back to these very internalized ideas that I've just been fed my whole life. But that doesn't help. That intellectual approach that I know is true does not fucking help me in the moment. It doesn't help me at 2 a.m. when I feel so bad about texting my mom to have her help me transfer so I can go pee because I chugged a bunch of water. It doesn't help me when I wake up at 3 p.m. in the afternoon and I'm fucked because I just missed like 3 doses of meds that needed to happen. None of that helps me. It doesn't help me when I don't respond to my friends' texts and they text me because they're worried about me and I text them back saying I'm alive, but I can't text you right now. I know that I'm a worthwhile person. I know all of my great qualities. I know that existing while disabled is radical, and I want to keep doing that. I know that, in part, my existence is revolutionary. It goes against everything the government stands for. It goes against everything society stands for, and I'm proud of that. But I also know that I would give anything to be healthy, and I don't know how to reconcile those feelings. And I brought it up to my therapist, and that was kind of a dead end. I love her. She's great. But she's completely able-bodied. And I think it's not really something that healthy, able-bodied people can understand. I know how to exist as a disabled person, no matter how broke or how outcasted or whatever it may be. I can live with that. I like that. I'm proud of that. I'm not sure how to exist within my own body. I'm not sure how to exist within the gender people think I am. I'm not sure how to exist with my own diseases. There's something called ICU psychosis, which I didn't think was a real thing until I learned it was a real thing. Where when you're in the ICU, and there are people coming in and out of your room every hour to check your vitals, and even more than that. And the door is clear glass, and it's always open or cracked, and you can hear everything, and it's loud, and there's beeping. IV poles are beeping. Your cardiac monitor is beeping. You have oxygen covering your nose and mouth, so everything you say is muffled, and everything hurts. And you don't know what time of day it is, and there are no windows, and it makes you crazy. It makes you lose touch of reality. And of course it doesn't just happen in the ICU, it can happen in regular hospital rooms. And I thought it was kind of bullshit. And I read this study about how some crazy percent, like 70% or something, of people who survive being in the ICU show signs of PTSD. And I thought it was not true. It's totally true. I've been completely in denial of this, but I've had trauma related to hospitals for years. Since before anything started. Since getting my appendix out at 6 years old. This recent stint in the hospital where I was really on the brink, there are still nightmares about it. There's still fear tied into that. I was talking with someone about doctors not believing people and bad hospital experiences we had, and I was recounting an experience when I was having an allergic reaction, and I got panicky. I could feel the pain in my stomach. I could feel my throat closing up, and it wasn't real. But that trauma is real. And I did an episode, it's probably a few episodes back, about the trauma of doctors. But I just want to say that it's not some abstract concept. It's what I'm thinking about right now at 2 a.m. with the lights off. This episode's a mess, I know that. I've rambled, I've talked probably too much about personal stuff. I've hit on gender, and I've talked about how much I hate the hospital. And I want to clarify something. I know some people have a problem with saying crazy to describe like negative things, and I completely understand that. I say it as someone who deals with mental illness, and in a way that is reclaiming the word. I'm very, very sorry if that hurts some people, and I would love to discuss it and talk about it because I think it's really important to examine our own misuse of language sometimes. But I want people to know that that's my intention when I say the word. I would also like to say, if there are any able-bodied people listening, please, I'm begging you, you're more than welcome to listen to this, but I'm begging you, I don't want to hear any, you're so brave, or you'll get through it, or, you know, like, I'm so sorry you're dealing with this. I don't want to hear it. I don't care what your intention is in saying it. Disabled people, chronically ill people, you're more than welcome to say whatever you want. I need words of encouragement. Please lay them on me. Like, seriously. I know I'm needy, but, you know. But able-bodied people, it hits me in a place, and I've touched on it. I will touch on it more, but I don't want to hear about how I'm going to overcome this, or how inspirational or how brave I am. I do not want to hear it. It's patronizing. It's condescending. You don't understand what I'm going through. And while I appreciate the sentiments, and I appreciate you listening to this, and I encourage you to keep listening to this, this is an episode that I ask you don't comment on. My aunt got me a necklace, and it has a Hebrew saying on it, and I'm going to pronounce it wrong. I'm much more fluent in Yiddish than I am in Hebrew, but it says Akol Asherif on it, which basically means, fuck what society says. You will survive this, and you will overcome this. And it's an idiom. It's not really a platitude, so it doesn't translate that well. I'm not great at translating it, and I don't know really enough Hebrew to translate it into English in like an appropriate way. But just trust me when I say it's not platitude-y. It means a lot. And I just want to say this is completely separate from religion. But to everyone listening to this, fuck what society says. You will survive everything. You're gonna survive this. Whatever it is, I know you will. Thank you for listening to me ramble. Thank you for listening to my unorthodox episode. Consider subscribing, whether it's on YouTube or you're listening on the podcast app. Really helps. And as always, take care of yourselves.